The physiology of the female reproductive system. The ovaries are the female gonads. There are two, one at each entrance to the fallopian tube. They are each about 2 to 3 centimeters in length, about the size of an almond. The ovaries are located within the pelvic cavity. The ovary itself is attached to the uterus via the ovarian ligament. The ovarian stroma forms the bulk of the adult ovary. Oocytes develop within the outer layer of this stroma, each surrounded by supporting cells. This grouping of an oocyte and its supporting cells is called a follicle. The fallopian tubes. Fallopian tubes are not connected to the ovaries. Instead, fimbriae catch the oocyte like a baseball in a glove. The fallopian tubes are the conduit of the oocyte from the ovary to the uterus. Each of the two fallopian tubes is close to, but not directly connected to, the ovary. The isthmus is the narrow medial end of each uterine tube that is connected to the uterus. The wide distal infundibulum flares out with slender finger-like projections called fimbriae. The middle region of the tube, called the ampulla, is where fertilization often occurs. The fallopian tubes have 3 layers: an outer serosa, a middle smooth muscle layer, an inner mucosal layer. In addition to its mucus-secreting cells, the inner mucosa contains ciliated cells that beat in the direction of the uterus, producing a current that will be critical to moving the oocyte. The uterus and cervix. The uterus is the muscular organ that nourishes and supports the growing embryo. Its average size is approximately 5 centimeters wide by 7 centimeters long, and it has 3 sections. The portion of the uterus superior to the opening of the uterine tubes is called the fundus. The middle section of the uterus is called the body of the uterus, or corpus. The cervix is the narrow inferior portion of the uterus that projects into the vagina. The cervix produces mucus secretions that become thin and stringy under the influence of high systemic plasma estrogen concentrations, and these secretions can facilitate sperm movement through the reproductive tract. The wall of the uterus is made up of 3 layers: the perimetrium, the most superficial layer and serous membrane; the myometrium, a thick layer of smooth muscle responsible for uterine contractions; the endometrium, the innermost layer containing a connective tissue lining covered by epithelial tissue that lines the lumen. It provides the site of implantation for a fertilized egg and sheds during menstruation if no egg is fertilized. The physiology or function of the female reproductive system. Ovulation. Following ovulation, the fallopian tube receives the oocyte. Oocytes lack flagella and therefore cannot move on their own. High concentration of estrogen that occur around the time of ovulation induce contraction of the smooth muscle along the length of the fallopian tube. These contractions occur every 4 to 8 seconds, causing the oocyte to flow towards the uterus through the coordinated beating of the cilia that line the outside and lumen of the length of the fallopian tube, which pulls the oocyte into the interior of the tube. Once inside, the muscular contractions and beating cilia move the oocyte slowly toward the uterus. When fertilization does occur, sperm typically meet the egg while it is still moving through the ampulla. The menstrual cycle. The 3 phases of the menstrual cycle are: 1. The Menses phase of the menstrual cycle is the phase during which reproductive hormone levels are low, the woman menstruates, and the lining is shed. The Menses phase lasts between 2 to 7 days, with an average of 5 days. The Proliferative phase is when menstrual flow ceases and the endometrium begins to proliferate. During this phase, reproductive hormones are working in homeostasis to trigger ovulation on approximately day 14 of a typical 28-day menstrual cycle. Ovulation marks the end of the proliferative phase. The secretory phase, the endometrial lining, prepares for implantation of a fertilized egg. If no pregnancy occurs within approximately 10 to 12 days, the endometrium will grow thinner and shed starting the first day of the next cycle. Diseases and disorders of the female reproductive system. Cancer. Breast cancer. Breast cancer starts in the cells that line the ducts or the lobule of the breast. Some warning signs include a new lump in the breast or axilla, thickening or swelling, irritation or dimpling of the breast skin, redness or flaky skin, pain, discharge, all in the breast or nipple area, and change in breast size. Risk factors include family history, obesity, hormonal treatment, and changes in breast cancer-related genes, BRCA1 or BRCA2. Treatment options include chemotherapy, radiation, and surgical interventions such as mastectomy, biopsy, incision and drainage, and mammoplasty. Cervical cancer. Cervical cancer is typically slow-growing cancer and is highly curable when found and treated early. Advanced cervical cancer may cause abnormal bleeding or discharge from the vagina, such as bleeding after sex. It is diagnosed during a pap smear, which looks for precancers, cell changes on the cervix. The pap test can find cervical cancer early when treatment is most effective. The pap test only screens for cervical cancers. The Hpv test looks for Hpv strain, which is the virus that can cause precancerous cell changes. Almost all cervical cancers are caused by Hpv. Hpv is a common virus that is passed from one person to another during sexual contact. There is an Hpv vaccine. The age of administration varies. Endometriosis. Endometriosis is an abnormal condition of the endometrium. Endometriosis occurs when this tissue grows and implants outside the uterus. The female hormone estrogen causes these implants to grow, bleed, and break down. They are implanted outside the uterus and have no way to leave the body. They become painful, inflamed, and swollen. The inflammation causes scar tissue around nearby organs, which can interfere with their normal functioning and cause pain. Endometriosis generally appears between the ages of 15 and 50. Signs and symptoms may include dysmenorrhea, lumbago, dyspareunia, menstrual irregularity, and infertility. 1/3 of women diagnosed with endometriosis have no symptoms at all. Diagnosis may include laparoscopy and endometrial biopsy. Treatment may include medication, surgical interventions, such as hysterectomy and oophorectomy. The cause of endometriosis is unknown.